everybody. Welcome to my show. Autumn is here. I'm your host, Francine Crawford. And today we have a special guest. We're going to speak to Miss Reverend Dr. Lula Mae Phillips. She works with Weill Cornell Medicine in the Clinical and Translational Science Center. She has a wealth of information to help people to be able to help their person that they're caring for, or to help seniors and give them advice and give them some resources. Welcome to the show.
Thank you so much. I really appreciate being here with you, Miss Francine Crawford, and your wonderful audience. Thank you.
Thank you. Well, thank you so much for giving us some time on Autumn is Here. I know that you worked a lot with seniors. You worked all over. You were a nurse and different things. So I just like you to tell us a little bit about yourself.
Well, I have been a nurse for over, I'll just make it simple, 30 years. I've been a nurse and I've worked in various places. Very few hospitals have I missed. I've worked in most hospitals, the large hospitals in the city. I've worked for city hospitals, private, and I've worked in long-term care facilities. I have worked as an educator, as a director of nursing. I've worked as a consultant in various long-term care facilities. So I know quite a bit about working with seniors and quite a bit of what they need. Currently, at Weill Cornell Medicine, Clinical Translational Science Center, part of my job is to outreach to the community and get the community involved in research. And that includes getting seniors involved in research. So in order to support that, at the Clinical Translational Science Center at Weill Cornell Medicine, we have various programs just to support seniors and to educate seniors and bring them up to date and what we're doing in research in various areas.
Okay, so you have programs that you do research. Is it like just certain health programs? Can you tell us a little bit about that?
Well, these are the basic, I will give you an overview of the basic programs that we have at Weill Cornell in the community core, because there's various cores and the different cores do different things. So in the community core, what we have is something called a health fair, where we take this health fair, our mobile health fair, out to the community. We take it to churches, synagogues, mosques. And in these places, what we do is we do blood pressure screening, A1C screening, which is for diabetes. Currently, we have an ophthalmology team that joins us, and we have cancer screening that will occur in Brooklyn and in Queens. So basically what we do is collect data, we collect information. We educate the community. We educate as we give out education to all those who attend our meetings. And what we try to determine is, do they learn anything? Are they learning anything as we do these different healthcare interventions? On the teams, it is a collaborative approach. So working with Weill Cornell Medicine, we have Cornell University Cooperative Extension, which we have a nutritional program. While we have Memorial Sloan Kettering, we have Hospital of Special Surgery, Hunter School of Nursing, Hunter School of Public Health. I'm just trying to remember. I think we may have a few more, but I think that's about it. And from each one of these schools, we have students. For example, from Hunter Bellevue School of Nursing, we have nursing students who come out and participate in engaging with the community and educating the community. We have medical students from Weill Cornell Medicine. This summer, we're going to have medical students who are going to come up, I think, from Virginia U. We have nutritional students that come from Cornell University in Ithaca. Mm-hmm. So we have different schools that come together, different students that come together, different students who bring their expertise along with their professors, along with their instructors. So they go out to the community, and what they do is give information to the community members. And then in maybe a month or so, we evaluate to see if they learned, if they heard, if they understood. We also do a lot of nutritional education, because what we're starting to realize in the healthcare arena is that people are what they eat. Mm-hmm. So we do a lot of educating. And a lot of this occurs in churches, because churches and synagogues and mosques, they are the center of the community, and community members will tend to gravitate to these areas, and they listen a little better in churches and in synagogues and mosques. So we educate there. We also have a program called Civic, which is a community interactive video conferencing. And what we do is we get experts from Cornell. So any of the Cornell campuses, uptown, downtown, east side, west side, any of the Cornell campuses, we will ask an expert to do a presentation. We will do breast cancer, prostate cancer, diabetes, any of the topics, autism, Alzheimer's, emotional insecurities, anxiety, because especially during COVID, we had, because there was so many people that developed and came down with various anxieties. So we had experts that would talk about how to manage how the feelings that present themselves or the behaviors that present themselves. And what we would do prior to COVID, we would have the expert on campus at our sites, and they would do their presentation, and we would have just a straight video talk from our office to that particular site. But because of COVID and the intervention and introduction of Zoom, we started to we did the same talks, but now we'll do them 5 or 6 different sites at the same time. So what we're finding is that Zoom has, COVID had its problems, but it created a few benefits. And one of the benefits was allowing people in multiple sites to hear a well-known presenter on a topic in a senior center. So that is working out well. And a lot of the senior centers are in food pantries, and some of them are in churches. And that, again, is working out well. So people ask questions. And what we're finding is that when people are in a community where they feel secure, respected, they are not so ashamed of asking questions that they may not ask otherwise. And that is our civic talks. We also have a few more. We have 2 more that we do that are large. We do other things, but we also have an opioid overdose prevention program. And with our opioid overdose prevention program, what we do is we go out into the community and we give talks on the opioid epidemic, and we introduce people to the behaviors or how a person will present themselves if they have overdose and what we can do about it. And we give out naloxone, which is a medication that reverses opioid overdoses. And that's been fairly successful. It really, really has.
So let's talk about screenings. There are certain tests that I believe that seniors they may or may not know that they should take. So can you talk a little bit about some screenings and tests that they should take that that many of them may not know about, or because sometimes seniors have been to their doctors and they go through a routine. Okay. And they're not aware of certain things that they should at a certain age.
Now, I'm just one thing for sure: all seniors need their blood work done.
Okay,
and they need what they need checked, basic blood work, and they should be checked to see if they have any infections. They should. One of the things that people who have been on blood pressure medicines for extremely long time, for years, they need their kidneys checked. They need their urine checked. Because sometimes from some of the water pills, some of the high blood pressure pills, side effects, kidney dysfunction.
Wow.
So if you look in our communities, okay, there's two sides. Some of the blood pressure medicines, most of them work pretty good. Unfortunately, in the African American community, you're going to ask people who are on hypertensive medications, and a lot of them are on more than one pill. Ask them, do your own research, do your own survey. Say, how's your blood pressure? A lot of them, sometimes they don't take their blood pressure medicines the way they're supposed to. That's number one. Number two, they need to monitor their blood pressure medicines for side effects. If you look in our communities, there more and more you have kidney dialysis units. And a lot of times, okay, that is related to, it could be because the blood pressure is not being managed, that people are not taking their blood pressure medications, or it can also have something to do with their sugar levels. So they need to be monitored, proactive. Everybody needs their own blood pressure cuff in their homes. They need to take their blood pressure, jot it down, take their medications. And if the medications are not working, go back and tell the primary care provider, my blood pressure pills are not working. When people get to be a certain age, now I have to say certain age because I don't remember the exact age. I don't remember if it's 60, 62, 65, but they need screening for colon cancer. They need the screening. And some people are upset because they put them to sleep and they put a sigmoidoscope or a tube in their rectum to see if they have any polyps or anything like that. And some people are very fearful of it. And it's nothing really to be afraid of. If they're prepped, if you have a good doctor, it's something that it needs to be done. If people have to be mindful and watch the stool. Watch the color of the stool, watch the odor of the stool, because again, when people get polyps and develop colon cancers, the stool changes color. And if there's bleeding in your gastrointestinal tract, depending on where the bleeding occurs, you get changes in colors. But sometimes what you'll have is dark tarry stools that are like tarry and they're sort of sticky. And a lot of times that is blood. So people need to watch their stool. They need to pay attention, and they need to go to the doctor and tell him. One of the big problems you'll find is a lot of people don't tell the doctor everything. They tell them a little. They tell them what they think is necessary. Women, African American women, need to check their breast for lumps. And sometimes people like to think the older they get, all of that disappears. Not true. Not so. A lot of people get, and I don't remember the stats, breast cancer after menopause. So they need to check their breasts for lumps, especially if you see it's in families. Check. They need to check. That's like pancreatic cancer, colon cancer, everything that you see in families. People need to check themselves. The other big issue in seniors is diet, food. Sometimes when people get to a certain age, they stop cooking. I don't cook anymore. It's nobody but me. I'll go out, I'll get a hamburger. I'll get, no, they need to eat. And if the problem is teeth, they need to go buy a set. Or get their teeth fixed. Right. Because they need fresh fruits and vegetables. They don't need fried and refried. They just a variety of food, and not a lot of sugar, not a lot of carbs, and not a lot of processed. Because the more processed food we eat as we age, the likelihood of developing diabetes increases. For example, in certain communities in the city, and since you're in Brooklyn, and I'm in Brooklyn as well, certain areas in Brooklyn, diabetes is epidemic. Mm. So if you look at Bedford-Stuy, Bushwick, Flatbush, all the adjacent areas around Flatbush, diabetes is epidemic proportion. Mm. I don't remember the numbers right off, but they're not good. The older men, one of the things that men don't like to talk about as they age is prostate enlargement of the prostate gland. Some of them become ashamed because they have to have a rectal. If the doctor really wants to feel the gland, he has to put a glove on and put it in the person's rectum and feel. And there's nothing wrong with it if it's done properly. But they have to be prepared for it, and they have to be willing to go through that. So often, one of the things that's killing African-American men is prostate cancer. Mm. Whereas in other groups, you don't have those issues. I know, I'm trying to remember, maybe about 10 years ago, I think Harry Belafonte at that time had prostate cancer. And at that time, what they said was, because normally they do PSAs for prostate cancer, and they look at the range and the numbers. And what they said was that it was not a true indicator of cancer in African-American men. So what they said, they no longer needed to do it as often as it had been recommended previously. So what they did was they decreased the number of times that they would screen an African-American man for prostate cancer. And as a result of that, more Black men died from prostate cancer. And then they went back and looked at the study and found that the study that said that they should decrease the number of times they examined the person looked at the PSAs was wrong. Wow. So now it got to the point that if an African-American male wanted additional PSAs or levels to examine their prostate, the hormones that were secreted from the prostate, from the gland, they would have to pay for it themselves, or they would have to fight their insurance company. So, well, that means awareness. They have to pay, we have to pay attention. And when I say we, I'm saying the women are the ones that say to the guys, listen, honey, I'm going to go with you to the doctor. I'm going to hold your hand. We're going to talk about it because they need it.
I think a lot of times, with women and men and seniors, it should be a point where you have to take someone with you. You should take someone with you to the doctor, because sometimes it's overwhelming. And sometimes, you're so used to your doctor, you just kind of go along with whatever. And that if you took your daughter or son or granddaughter, whatever, they could ask other questions. They can say, well, Mom, remember you were having headaches or whatever, because some things you don't remember, or some things it passes. A lot of times some things pass. By the time you go to the doctor, It's not there. So you don't even mention it, so a lot of times, I like to suggest that people just take somebody with you and write down everything, write down things that happen, write down a date that it happened, whatever, because, your doctor, especially if you have a doctor that has your history, he can compare certain things. If you jot it down and, this never happened to you before or things like that, or you're not likely for this to happen, maybe it's something else happening in your body. So, it's very good for seniors to have that extra help and somebody to come with them to the doctor to help them and just to remember everything and just to ask certain questions, and get comfortable with that.
Yeah. That is so true. What I tell people, I tell them exactly what you said, but I also tell them, listen, take your notes and read them. And when he answers question 1, cross it off. When he answers question 2, cross it off. And if he doesn't have time to answer your questions, see the nurse. If she doesn't have time, get a new doctor. Yes, because your health is important and you need somebody to talk to you about you.
We talk about a lot of different illnesses and things like that. Can we talk a little bit about the heart, about things that affect, the heart?
Well, when you look at the heart, I'm going to tell you, one of the biggest problems when you look at heart disease, it's a huge area. And I'm not going to tell you, by no means am I an expert. But when you look at heart disease, one, you have to consider if the person is within normal weight or if they're overweight. Because the larger a person is, the harder the heart has to pump. The more miles to the blood vessels, so the more work that the heart has to do. So it's healthier for a person if their heart stays within normal, like if their body is fairly within normal range. One of the things that we have up at Weill Cornell is we have a program called Heart Smart. And it is a program that is run by Dr. Teti. I think her name is Dr. Solo Teti. Excellent program that really her focus is to get people up to walk and move around so they can control their weight, monitor their blood pressure, and to eat healthy. And to eat healthy, one of the things that she encourages is people to eat a plant-based diet, basically, because she has found that people who eat plant-based diet control their weight is easier. They maintain their weight, and that's important. So, but as people age, there are various things that go on with the heart. For example, sometimes the heart may skip beats or drop beats. That's one problem, okay? Then you have sometimes the heart races. And anytime you get an alteration in the rhythm of the heart, you get breathing problems. You may get swelling problems. So then depending on which side, if it's on the right side or the left, or is it the blood going back to the heart or is the blood coming out of the heart? So you get various problems. But with a heart condition, it's important. Take your medications as prescribed. Sometimes you have to monitor your weight. The people have to monitor weight because if they gain weight rapidly, a lot of times it's water weight. It's related to water. So one of the things I would say is, like, if you really want like in depth, you need expert, but to explain the function of the heart, the right side of the heart, what it does, the top of the heart, bottom of the heart, and you'll start to understand. You can have heart problems that impair the blood going to the brain, and people have difficulty thinking. People will faint because the heart isn't pumping the blood to the brain. If the blood is not coming from the lower extremities and the blood is pooling in other words, the blood stays in the legs or stays from the waist down. And so what happens is people got water, we've heard of water weight. They have water weight. So they have to get the water out. Now, when you start to look at all of these, you cannot rule out the fact that liver problems will cause increased liver problems, water. Now, then you say, what caused the liver problem? Sometimes it's a history of drinking. Or when you've heard of people who have cirrhosis of the liver or hardening of the liver, a lot of that is associated with alcohol. Even though we talk a lot about, in our society overall, we talk a lot about drugs, overdoses, but you know what we don't talk a lot about?
Alcohol.
Exactly. And we don't look at the number of people who are dying from alcohol-related conditions. Wow. Yeah, and I think we would be surprised. We really would be, because a lot of people are dying from alcohol-related issues.
Wow.
Yeah.
That's interesting. Question, let me ask you something. You mentioned something about that you were, I think you worked in long-term care before.
I worked in long-term care. Mm-hmm.
And I'm just curious about something because, my mom was in a nursing home for quite some time. I've also have other relatives that were in nursing homes and things like that. And even recently. So I'm just curious about how the things that when someone comes into a nursing home, what I understand that they're supposed to, if they come from a hospital, the hospital has a care plan or whatever, they send that along and they're supposed to go along with that. Correct?
Correct.
Okay.
Now, this is what I'd suggest. When you have family, first, number one, if they tell you in the hospital, your family member needs to go to a nursing home, you need to ask them, what specifically does my family member need? For example, do they need physical rehabilitation? Mm-hmm. Do they need activities to keep them busy? What exactly would they benefit from? Would they benefit from just plain, ordinary, good, solid nursing care? And depending on what they tell you, you pick up the list to the nursing home, the whole nursing home list, and you go through the nursing home list. Go on your computer, evaluate. One of the things I didn't tell you is I am a nurse, and it's 8 of us. My mom had 4 nurses. I have a brother who's an acupuncturist. Mm-hmm. He's African-American acupuncturist, chocolate boy who reads and writes Mandarin. Mm-hmm. I have a brother who is a social worker, psychologist. And because I ran into this with one of my sisters, she became very ill. And I was used to being in and as a nurse, I was used to working in another element. And when you are used to working in an area, you look at the whole event differently. Mm-hmm. So what I had to do, I said, oh my gosh, I'm not used to looking at a nursing home or healthcare facility at a long-term care facility, I'm not used to looking at them as a place for my family member because I had to put my sister in one. So I had to step back and look at it from two views. Mm-hmm. One, I looked at it as just a community person who needed to place someone in a long-term care facility. And what I asked myself was, first of all, how is this facility rated? 1 star, 2 star, no stars. How did the Department of Health rate this facility? Because a lot of times what we do in our community is when they say, oh, your loved one needs to go into a long-term care facility, then people who are in the hospital will recommend, I think they should go to blah, blah place or this place or that place. And people usually say, okay, because they're so stressed out, they don't realize they need to check that place out. That's one. And the other problem that we have is I need to be close to the facility so I can get there after work. I can get there before work. I can get there on Saturday. So how we're looking at it as a consumer is how convenient it is for us and how it's so close to where the person currently is, and the social worker in that facility who's saying we should go over there, they should know. Well. Sometimes the reason why the social worker is recommending a place is because they need your bed for somebody else to come into the hospital. It may not be for the benefit. It should be. And if you ask them, it should be for the client's benefits. It shouldn't be for the hospital's benefit to empty the bed. It should be for your loved one's benefit to go to a long-term care facility. But it's not always the case. Mm-hmm. And that means it's hard questions. So as a consumer, you need to know, how was that nursing home or that long-term care facility, how was it rated? Mm-hmm. What did they say about it? You can look up the ratings, you can go in, you can Google them. What did they say about it? If you look up ratings and you look up information about a facility and they tell you, you read stories that you don't like, then you know what? Don't put them there. Yeah. Don't go by what's convenient for you because it may not necessarily be the best. However, it could be, but you'll have to do your work. And if you don't,
I don't think that people do the research or realize. I don't think people realize that they have to do the research. They have to look for it like as if you're looking for a place for you to live.
Exactly.
Plus, especially it's long term. So I don't think people realize that. And like you said, a good point. They're stressed out. So when the hospital suggests a place, you just kind of trust it. You know what I mean? So
I know.
Yeah, it's very difficult because people just don't think that way. And it's a good thing that, one of the things I suggest, like, people start thinking about it. You may never have to put your parent there. You may never have to. But just in case, while you have time, look into it. Look at the ratings of them. Look into the, people say, oh, there's a new nursing home, it's really nice, built up in our neighborhood. Just because it looks nice and it's pretty, doesn't mean the service is good. Doesn't mean, especially a new one, you don't have anything to kind of base it on, because if they knew, you don't know if there's turnover, if they have the lowest level of care or nurses or you don't know if they have experienced nurses and things like that. So, you really have to do your due diligence and try to do it ahead of time, just in case.
Well, you could, but if you don't have the luxury of the time or doing it prior to, then you go for a visit. If they won't let you through the door, Yeah, call the social worker on site and see if you can make an appointment to take a look at the facility. If they won't let you through the door, then let's go visit another one and another. But it's work, and it's not 1, 2, 3. You have to really dig in, and you have to look beyond the lobby.
Mm-hmm.
You gotta look beyond the lobby.
I like that. Yeah.
And you have to also pay attention. Mm-hmm. Let me hit this. You have to pay attention to patient-staff ratio. You have to see, you want to see how many aides or some home health attendants are on duty, and how many patients they are assigned to.
What would you say to the audience, something that you think that maybe they should know that people don't know, that people don't take advantage of, or something that will help other people in different communities that they should be in touch with?
Well, you know what? I think the thing that all of us need to know and realize, ask questions when you don't know. Mm-hmm. Don't take anything for granted. They could be questions that you feel are so simplistic that everybody knows it. No. Everybody doesn't know. Mm-hmm. And I think that's what trips us up, that we think that everybody knows except us. Mm-hmm. And a lot of people don't know. Mm-hmm. And I think it's okay. It's okay. I admit I don't know, and I'm asking.
Right.
And if you have to, call the Department of Health and the State Department to find out, call them. Mm-hmm. I'm not opposed to that. I think the biggest travesty, we don't ask enough questions. I don't care if the questions are simplistic. Everybody knows that. Well, if everybody knows that, please tell me, because I miss it. I wasn't there that day they gave out that answer, so let me know. Mm-hmm. And you're going to find that you're not on the line by yourself, that a lot of people have the same questions, but they're too ashamed to ask. Mm. So there's no stupid questions.
Right.
Ask them. Right. And write them down. Mm-hmm. And who said what when they said it.
Exactly. Well, it's for your health. So, it's for your well-being. So it's better for you to get as much information and as accurate as possible. And then you can compare, you can compare. Mm-hmm. So, but thank you so much. Dr. Lula Phillips. I appreciate it. You are a wealth of information. I'm sure I'm going to ask you again to come on, because I know that we have touched a lot of things that you have been involved in, and that things that you have knowledge of that can help people. So I really, really enjoyed this, and I really hope that we can get a chance to talk again.
It was my honor. I just hope I didn't rattle on, because sometimes I can rattle on. So it's my honor and my pleasure. And thank you so much for having me. Okay. And I just appreciate this opportunity. God bless you. God bless you. God bless you, and good night.
Okay. God bless you. Good night.
Good night.